Hello, welcome to my channel BioQuest MCQs. This video is regarding MCQs on lipid metabolism. Which of the following enzymes is responsible for the rate limiting step in fatty acid synthesis? Acetyl CoA carboxylase, fatty acid synthase, hormone sensitive lipase, carnitine acyl transferase. Correct answer is acetyl CoA carboxylase. Which lipoprotein is primarily responsible for reverse cholesterol transport? LDL, VLDL, HDL, chylomicrons. Answer is HDL. What is the end product of hot chain fatty acid beta oxidation? Acetyl CoA only, malonyl CoA, succinyl CoA, propionyl CoA. Correct answer is propionyl CoA. Which lipid parameter is most closely associated with a reduced risk of cardiovascular disease? High LDL cholesterol, high HDL cholesterol, high total cholesterol, high triglycerides. Answer is high HDL cholesterol. What is the reference range of HDL cholesterol in men? Above 20 mg per dl, above 30 mg per dl, above 40 mg per dl, above 50 mg per dl. Correct answer is above 40 mg per dl. Which lipoprotein is referred to as bad cholesterol? LDL, HDL, VLDL, chylomicrons. Answer is LDL. Which lipoprotein is largest in size but lowest in density? LDL, HDL, VLDL, chylomicrons. Answer is chylomicrons. Non-HDL cholesterol is calculated as LDL, HDL, HDL triglycerides, triglycerides LDL, total cholesterol HDL. Answer is total cholesterol HDL. The most predominant lipid component of chylomicrons is cholesterol, phospholipids, triglycerides, free fatty acids. Answer is triglycerides. Chylomicrons are lipoprotein particles primarily responsible for the transport of dietary lipids from the intestines to other parts of the body. They are composed of mainly triglycerides, about 85 to 90%, making them the most abundant lipid component, followed by smaller amounts of phospholipids, cholesterol, and proteins. Cholesterol synthesis is controlled by feedback inhibition of the enzyme HMG-CoA synthase, HMG-CoA reductase, acetyl-CoA carboxylase, mevalonate kinase. Answer is HMG-CoA reductase. HMG-CoA reductase is the rate-limiting enzyme in cholesterol biosynthesis. It catalyzes the conversion of HMG-CoA to mevalonate. Cholesterol exerts feedback inhibition on this enzyme, thereby regulating its own synthesis and maintaining homeostasis. This enzyme is also the target of statin drugs used to lower cholesterol levels. A compound possessing hydrophobic and hydrophilic groups in its structure is known as amphipathic, hydrophilic, hydrophobic, lipophilic. Answer is amphipathic. An amphipathic compound contains both hydrophilic and hydrophobic regions. This dual nature is characteristic of molecules like phospholipids, which form the structural basis of cell membranes. Niemann-Pick disease is due to the defect in the enzyme. Niemann-Pick disease is due to a defect in the enzyme glucocerebrosidase, hexosaminidase, sphingomyelinase, galactocerebrosidase. Answer is sphingomyelinase. Niemann-Pick disease is a lysosomal storage disorder caused by a deficiency of the enzyme sphingomyelinase, leading to the accumulation of sphingomyelin in various organs. This results in symptoms like hepatosplenomegaly, neurological deficits, and in severe cases, early childhood death. The lipoprotein involved in the reverse cholesterol transport is LDL, VLDL, HDL, chylomicrons. Answer is HDL. High density lipoprotein plays a crucial role in reverse cholesterol transport, a process by which excess cholesterol is removed from peripheral tissues and transported back to the liver for excretion. This function is key in preventing atherosclerosis earning HDL nickname good cholesterol. The disorder in which long chain fatty acids are not oxidized due to the absence of peroxisomes is known as Tay Sachs disease, Zellweger syndrome, Repsum disease, adrenoleukodystrophy. Answer is Zellweger syndrome. Zellweger syndrome is a rare congenital disorder characterized by the absence or dysfunction of peroxisomes, which are essential for the beta oxidation of very long chain fatty acids like C26 to C35. The accumulation of these fatty acids in tissues leads to severe developmental abnormalities, neurological deficits, and often early death. Acetyl CoA from the mitochondria is transported into the cytosol after its conversion to malate, citrate, pyruvate, oxaloacetate. Answer is citrate. Acetyl CoA cannot cross the mitochondrial membrane directly. To be transported into the cytosol, it combines with oxaloacetate to form citrate in the mitochondria. Citrate is then transported into the cytosol where it is converted back to acetyl CoA and oxaloacetate by ATP citrate lyase. The plasma lipoprotein that is inversely correlated with coronary heart disease is LDL, VLDL, HDL, IDL. Answer is HDL. High density lipoprotein is known as good cholesterol because it helps remove excess cholesterol from peripheral tissues and transport it to the liver for excretion. Higher levels of HDL are inversely correlated with the risk of coronary heart disease, meaning that as HDL levels increase, the risk of CHD decreases. The fatty acid that is commonly found in the C2 position of triacyl glycerols is palmitic acid, stearic acid, oleic acid, arachidonic acid. Answer is oleic acid. In triacyl glycerols, the C2 middle position of the glycerol backbone often contains an unsaturated fatty acid, most commonly oleic acid, that is a monounsaturated fatty acid, and the C1 and C3 positions usually contain saturated fatty acids. This arrangement affects the physical and metabolic properties of TAGS. The total number of ATP produced by the oxidation of a molecule of palmitic acid is 32, 64, 106, 129. Answer is 106. So, palmitic acid undergoes beta oxidation producing 7 NADH and 7 FADH2 from 7 cycles and 8 acetyl CoA. So, this gives the net ATP 106. The following substance is ketogenic: fatty acids, leucine, lysine, all of them. Answer is all of them. Fatty acids can be converted into acetyl CoA, which is ketogenic. Leucine and lysine are strictly ketogenic amino acids because their catabolism produces acetyl CoA or acetoacetate, which can form ketone bodies but not glucose. Thus, all listed substances are ketogenic. The lipoprotein possessing the highest quantity of phospholipid is HDL, LDL, VLDL, chylomicrons. Answer is HDL. HDL particles have the highest relative content of phospholipids, which play a key role in their function of cholesterol efflux and transport. This high phospholipid content helps HDL maintain its structure and interact effectively with enzymes and receptors involved in lipid metabolism. Hypercholesterolemia is observed in disorders: hypothyroidism, diabetes mellitus, nephrotic syndrome, all of them. Answer is all of them. Hypothyroidism leads to decreased LDL receptor activity, causing elevated LDL cholesterol. Diabetes mellitus causes dyslipidemia characterized by increased LDL and VLDL. Nephrotic syndrome results in increased hepatic lipoprotein synthesis, raising cholesterol levels. Therefore, hypercholesterolemia can be seen in all these conditions. Hormone sensitive lipase activity is inhibited by the hormone epinephrine, insulin, thyroxine, glucocorticoids. Answer is insulin. Hormone sensitive lipase is activated by hormones like epinephrine and glucagon to promote lipolysis. Insulin, however, inhibits HSL activity by promoting its dephosphorylation, thereby reducing the breakdown of triglycerides and promoting fat storage. The two final products in the beta oxidation of short chain fatty acids are acetyl CoA and malonyl CoA, acetyl CoA and acetyl CoA, acetyl CoA and propionyl CoA, acetyl CoA and succinyl CoA. Answer is acetyl CoA and propionyl CoA. Short chain fatty acids undergo beta oxidation producing multiple acetyl CoA units and a final propionyl CoA unit. Propionyl CoA is then converted into succinyl CoA before entering the TCA cycle. Thank you for watching my video. Please subscribe.